What is newborn circumcision? Circumcision is a surgical procedure that removes the foreskin, the fold of skin covering the tip of the penis. It's one of the oldest medical and cultural practices in the world, and it can be done for religious, cultural, or medical reasons, or sometimes based on parental preference. In medical settings, circumcision is typically done within the first few days after birth for newborn boys under local anesthesia by a trained healthcare professional, nurse, doctor, or midwife, depending on setting. There are several common reasons families want to choose circumcision. Religious or cultural traditions. In many communities, e.g., Jewish, Muslim, some African and Pacific Island cultures, a circumcision is a rite of passage or spiritual requirement. 2. Hygiene and health beliefs. Some parents choose circumcision, believing it may make hygiene easier as the child grows. 3. Medical indications, less common. Sometimes circumcision is recommended later in life for conditions such as phimosis, a tight foreskin that can't retract, recurrent infections, or chronic inflammation. Circumcision is a personal decision, not a universal medical necessity. Here's what current research and guidelines say. May reduce risk of urinary tract infections, especially in infancy. Lowers lifetime risk of some sexually transmitted infections, including HIV, in certain populations. Prevents foreskin-related issues like phimosis or balanitis. Possible risks: pain, bleeding, or an infection at the surgical site. Rarely, too much or too little skin removal. Incomplete healing if aftercare isn't followed properly. When performed by a trained medical professional under sterile conditions, the risk of complications is low, but it's not zero. If parents choose circumcision for their baby, gentle care afterward is essential. 1. Keep the area clean and dry. Use warm water, no harsh wipes, for a few days. 2. Apply petroleum jelly to prevent sticking to diapers. 3. Expect mild redness or swelling for a few days, but if there's persistent bleeding, pus, or fever, seek medical attention. 4. Let the wound heal naturally. Avoid pulling or scrubbing the area. Healing usually takes 5 to 10 days. Talking about circumcision as a parent. This decision can bring up questions, guilt, or cultural pressure, and that's normal. Ask questions before deciding and understand both the medical facts and cultural context. Remember, there's no one-size-fits-all answer. Informed choice is what matters most. Circumcision is a personal choice, not a judgment. As parents, your role is to ask, learn, and choose what's best for your child with compassion and knowledge.